Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting on the This Just In studios from the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 237th episode, we have a very special show dedicated to the HIMSS annual conference in Orlando. And we'll do a great recap of what we saw last week and a very special guest with me on air today, Mr. Bradley Dick. Welcome back to the show, my good friend.
Thank you, Justin. This is truly a treat. I mean, we just got to spend the time at HIMSS, and now we get to have a quick follow-up. So I'm really excited for the show.
Yeah, and I appreciate you jumping on air so quickly with me. I did not want to wait too long. It's obviously still top of mind. We just left the show, 2 days ago? So, I'm just excited. First of all, thank you again for jumping on air so quickly with me. So let's just dive into some of the cool stuff that we saw. And I think I'll start off with just the overall being at the conference. Just having, I think I probably saw 150 people that I, from my past, that I didn't realize how much I missed and just how great it was being, in the proverbial, the same room with all of them, and then spending multiple days with them and seeing them in just different types of venues across the conference. So that was kind of high level, was awesome. And I think, and I certainly want your opinion on this, but I was actually surprised. I don't know if they got to 30,000 or what the final number was. I did not catch a count. I'll get that count, I think, next week. And I will do, I think, a few more follow-on shows because there was a lot of good stuff at this conference. Again, it's the first time all of us were back in the same room at this type of scale in over 2 years. But again, I think they've approached 30,000 people. I think we're at closer to 45, 50,000 people back in 2019. But obviously with COVID and the pandemic and all that followed, it trailed off a little bit, but just excited to be back in person. And that energy was felt throughout the entire conference, just the opportunity to collaborate, to talk, to strategize. And, I could feel it and everybody felt it. There's so much just joy on people's face, which again, I see a lot of that in our daily lives and what we see and read, unfortunately. However, it was at HIMSS22 in Orlando, and it was just so cool to be a part of. So what are some of your high level thoughts before we dive into the details?
Yeah, I mean, Justin, 100%. I mean, just being there and the energy and, I think the last count that I heard was around 27,000, but I mean, still, it was so great to see some people. I mean, I think I posted about it, but, I got to see like the entire leadership team of the former Merge Healthcare. And I hadn't seen all three of those guys in, probably at least a decade, if not longer. And I mean, it was just great to catch up with them. And, it's just, you know better than anybody else how small the healthcare ecosystem is. And I mean, it's like every single one of them is now a CEO or a chairman at another company. And I mean, it just really kind of speaks to the how close knit of a community we are. And you never know where somebody from one of your relationships might go. And it's just another connection. And it's just great because every time that you have that connection and you keep those people in contact in your life, you can just then you have another opportunity to branch out and learn more from the new organization that they're working with. So, I mean, that was great. And, by far, I love public speaking. I've done a bunch of webinars over the past, since the COVID days, but just to be in a room and get up in front of a group of people and kind of feel the energy and see people's faces and that stuff. You just can't, I mean, you know it, again, it just as well as I do that, there's no better experience than kind of interacting with people and having that opportunity to kind of share your views and get a lot of great feedback and hear the other great speakers at the event. So I just I mirror your request and I'm just so excited to be there.
Yep. So next question will be around what did we? I would love to get your thoughts on what you enjoyed the most. So once you kick that one off, what did you enjoy the most about HIMSS this year?
The main thing was, just kind of really getting back there and seeing HIMSS being the HIMSS of old, really kind of seeing all the vendors there, full, full
Regalia, I would say.
coverage for,
Yeah.
yeah, exactly. I mean, it wasn't these like, I was really kind of, concerned that it was going to be there, but like you weren't going to have the same people. I mean, you had, all the, the usual suspects. Epic had the most like amazing
Yeah.
booth, but I mean, I don't know, Salesforce, I think might be coming for them because that whole tree thing, that was just amazing. And,
Yes.
I mean, I just, it was approachable too. So it wasn't,
Yes.
I don't know. I think in 2019, that HIMSS was so busy, like you couldn't even walk down the main aisle. And, this way you were able to walk down the aisle and, if you had to stop and have a conversation, you didn't even, get caught up into the flow of just people. It
Right.
wasn't like walking on a New York city street. So, I mean, it was really great to see that. And, it was just, I don't know. It's just surreal because after so long, and I think that's kind of the biggest thing that I found interesting was that it was 2 years out of our lives that
Right.
everybody kind of like, oh, I haven't seen you in a year. No, like, no, it's been like 3 years. But it's like it's almost like
Exactly.
in our minds, it
Right.
didn't happen, and we picked right back up where we are. I mean, obviously, hopefully, we all remember what got us here. But I mean, at the end of the day, we just picked up and kind of, I think the human element of we just persevere.
Yep.
We're so resilient as people that it's like, oh, hey, it's like we never left.
Well, and I think that's an important point. We want to make sure people get out there, be part of this, community, be a part of this industry, this massive collaboration that we have going on, the openness. I think one of the things I heard in what you just said, but also as I was leaving and interviewing a couple of people on my way out, I said, hey, what did you like the most? And they said the collaborative spirit and the openness. And you said it even about, just being how you can walk around just more open, but even also people's attitudes around, hey, I want to work. I want to shake your hand. I want to meet you. I want to collaborate with you. I want to scale with you. That openness is what I felt. And also I think some of my people that I interviewed on the way out. So I love that. Going back to the booth, you mentioned, a few that you liked. I got to admit, I don't usually plug vendors, but I'm going to tell you, Juno EHR, we actually had our Georgia HIMSS reception there. I was very impressed being, a former chief marketing officer guy and doing marketing in some of my past worlds. Their booth was awesome, massive scale, but open, perfectly well designed, great color scheme. They even from a strategy of having multiple events hosted there. So kind of our happy hours after the day, everybody went there. I mean, I was very impressed with what Chris Cooney and that whole team has built and that company. I don't know much about the product and the company, but that booth, I was very impressed. You remember that booth?
Oh yeah, no, I definitely do. I think they were like silk screening, or I don't know
Yeah.
if they were silk screening, but they're
Everything
printing on
served.
TVs
Yeah.
and everything had like a it was like it was I don't know, they were like they took like little things and they like some were about him, some were about Star Wars, but not so it was very clever. And I mean, there's always a line.
There's
So
always
I
a
mean
line. Yeah, that's your goal at HIMSS is to get names and badge scans and business cards, and you want to future people to collaborate with and work with. They always had a line, and that's your goal at HIMSS. So they certainly achieved their goal there because they always had a line outside their booth.
And now that you brought that up, Justin, that was one thing that kind of there were times where especially even back in my past when I was a CIO, but because I wasn't a health system CIO, I would go into certain booths and when we started having conversations, they were so transactional. It was like, oh, as soon as they realized that oh, I might not be able to sell to them, like they would walk off. But I mean, every booth that I walked into, if I
Yes.
wanted to talk to somebody, I mean, they would walk me around and they would talk to me about. I mean, everybody was just so happy to be there.
You got it.
I really think that I didn't. It just clicked when you mentioned that, but I mean, everybody was just glad to be there and glad to be talking to people. So face to face.
So let's dive into some of the meat. I think some of the key themes. I'll start off with some of the stuff that I saw. And we read about some of this stuff, but I got some good, rich content. So some themes that I saw there, in no particular order, because there's a lot of important stuff that was there. And again, I'll do some follow-on shows here to cover some of these items even in greater detail and also more broad in some ways. But workforce challenges. Obviously, that's not just a healthcare issue, but COVID has really put a strain on our organizations. But I actually dove in with some executives from Athena, just around what they're kind of seeing with their and they got some actually a physician sentiment report coming out. I'll probably do a special show just on that because they're really staying tight to just that whole clinician. Obviously, it's a big piece of their business, but also what they're facing, the burnout challenges, and I don't have any details from them specifically on the report. But what I'm gathering across the whole HIMSS is that up to 50% of providers are, and this goes towards a sentiment, not necessarily provider burnout. We get the provider burnout. We understand why, and I'll talk about some of the fixes that they're suggesting. I think that we'll see here in the future, but also up to 50% aren't satisfied with what they do. That's a very large number. If 50%, not just the burnout, because we know about burnout, we read about burnout, but just, might you stay in what you're doing? May you, think about leaving, changing, your happiness, your optimism, is 50-50. So that's something that we really got to take a close look at because I talked to several experts that were at the conference. And if that is, and I believe that number, and if that optimism number is anywhere near, accurate, and again, it depends on where you are probably in culture, but also I don't think this is just healthcare. I mean, obviously, healthcare and providers are so critical to all of our communities and all of our lives. But a lot of our friends own companies and are CEOs and are running organizations in culture and understanding your culture. So this obviously transcends HIMSS, and that's what I wanted to be my very first item I spoke about, is you've just got to understand truly what you have. And if you're a CEO, that you're really transparently opening up these dialogues with your team, you want to siphon between gripes and just regular people who complain and real, true, fundamental culture issues that you might have, that you might be mistakenly fostering. That's something that I really, I saw a lot at HIMSS, a lot of conversations around, a lot of experts speaking to, and then it hits me as, I work with a lot of CEOs and speak with a lot of CEOs individually about their organizations. So from that perspective, so I'm really starting to see that. So I want to talk about that firsthand. But what did you see? What are some of the bigger themes that you saw at HIMSS?
Yeah, no, that was definitely a big topic. I think it kind of comes back to, anytime that you have, because I mean, let's be real. I mean, healthcare, you have to be mission driven when you're in healthcare.
Yes.
I mean, there's a,
So
I mean,
true.
yeah, I mean, there's a lot of people that do a lot of things, but I mean, the work that, especially, the clinicians, the physicians, the mid-levels, the nurses, like everybody in that entire ecosystem. I mean, those are tough jobs.
Yeah.
And I mean, if you
14,
if
18
you're
hour
not,
days at times. Yeah.
oh yeah, and I mean, if you're not enjoying what you're doing, it becomes unbearable. There was actually just an article that was just in Forbes, I think it was back on the 15th, where, it basically said it must be future-proof healthcare. 75% of current healthcare workers by 2025 might be leaving healthcare.
Yeah.
And I mean, I think that's scary.
Yep.
That's really scary because I mean, at the end of the day, it's, healthcare, there's a technology component, but at the end of the day, it's about taking care of people.
You got it.
And I think that's one of the things that I always kind of really stress. We need to realize that, it's not just, I think, the last time I was on the show, it's like, it's not just that's a medical record or that's, a patient data that we need to protect. It's a person, it's a human being. And, really kind of making sure that, in order to be able to take care of those people, you have to be in the right mindset. It's tough. It's tough right now. So, I mean, I think
what else?
that was.
Let's dive. What else did you see though? I mean, from a standpoint of some themes.
I mean, I really, I mean, obviously, I was kind of shocked by the explosion of, patient engagement platforms to the, I actually kind of liked, I kind of liked the way that HIMSS did it. And I was talking to one of my friends that's on that works for HIMSS, and I think he said that they're going to continue that.
Mm-hmm.
But I like how they kind of broke up HIMSS, where there's, like I think they've always had like the cybersecurity hub, but then they started breaking up the vendors where like it was like, I think there's like a whole patient engagement like hub area that had nothing but patient engagement vendors like in one area. And
Yes.
I really kind of like that because I mean, it made it really easy to kind of see, because I mean, you don't, and I wasn't saying that all of them were there, but I mean, just to see like how deep that market has become from, from the organization that I work with, Cure for You. I mean, a lot of the stuff that, I guess it's very validating from the simple fact that, 3 years ago, HIMSS, there definitely was not that level of engagement for that type of a service. But now it's like everybody has to have some sort of a patient engagement strategy.
Yep.
And I think that was probably the most eye-opening for me. I mean, that there was, you know, that there are now hundreds of companies that are now doing the same thing that we are, which validates our market point, but it's also going to make our industry and our organization better, because, you know, the more challenges that you have and the more competitors there are out there, the more to keep you on your toes, to keep you innovating and keep you working harder.
Yeah.
So I mean, that was probably the most interesting thing for me, just the sheer depth and breadth of that. Basically everybody has now come in, and it's not just, oh, we can't just do check-in, we can't just do scheduling, we need to have the whole end-to-end digital experience platform.
Yep.
It was impressive
Yep.
to see how many vendors there were there in just doing that.
So no, I completely agree. And just for my audience and sake of time, so a couple of things that I saw, you know, big hospital at home was a very big topic. A lot of people were showing up. It's still early, but I like what, you know, I saw what Mayo was doing. Very impressed. Verizon, you and I were actually at the Verizon booth a little bit, what they were doing. But there's lots of people that were, you know, hospital at home was a big topic. Health equity. I think one of the stats that I saw out there just around, I think it's 36% of organizations have a dedicated health equity budget. So really in their community and making sure they get the right strategies, resources, technologies, innovations, services. So that's, you know, that's very, very cool. That was one of the stats that I saw there. And then blending into that is social determinants of health was another big topic that obviously continues to grow. And vendors understanding they have to, you know, be able to take this information. And I might dive into that on another show, because that's actually a really big topic. Not only what we're doing from a government standpoint, we're creating some standards around that, and what these EHR vendors are doing, but also these organizations having to manage these types of social determinants of health type of data, when maybe some of these organizations don't have the technology because they're newer. I mean, it might be a homeless shelter, you know, and there's other components like that. They don't have technology. So we're bringing them into our ecosystem for health IT and how we manage some of our healthcare for our populations in certain communities. So that was really interesting to see the explosion of SDOH, and then obviously the continuing on of RPM and remote patient monitoring and best practices out there, and how to really optimize. What's interesting is everybody's still working on certain verticals, and it's not large scale yet. It's one thing I saw. Still, we're talking about cohorts, I say, or, you know, smaller groups of 1,000 here or 500 here, or I mean, maybe up to 5,000 total over here and for this RPM program, but not at massive scale. So that's one thing I noticed. What are your thoughts there?
Yeah, I mean, that's kind of the thing, is that, you know, I'm so excited about the concept of RPM, because I think we've been watching movies for the past. I mean, I remember since I was a kid, where, you know, you have the wristwatch, and the wristwatch kind of it can monitor your health, it can monitor, you know, your activity, it's how you pay for stuff. And I mean, like I was just so, as a kid, I just remember, because if you remember how they rebooted Dick Tracy, I don't know, I'm dating myself right now, but I remember, you know, they rebooted Dick Tracy when I was a kid, and I mean, that was just amazing to think that you have this device that you wear that can kind of like communicate with people. But then, you know, to the more like science fiction piece that's becoming a reality, you know, with the, you know, some of the new wearables. You know, I just really think that until it gets, you know, because you're 100% right. It's been going after specific use cases. And I mean, I think a lot of that has to do with, you know, the reimbursement structure on it. So, I mean, you know, I get that that's kind of an iterative step, and that's how we get there. And, you know, a lot of what we do in healthcare is driven by, you know, how it's reimbursed. So, I mean, obviously, don't want to belabor the value-based care, you know, but I think I'll beat that drum one. That's all I'm going to say about it, because I think we all know where that can go down. Because I think we all know that that's the direction that we need to be heading. But I mean, when we get to the point where it can be a device that you don't have to worry about or think about, and it's able to manage and monitor that stuff, that's when it's going to hit to scale. Because, you know, it's like with anything with technology, is that, you know, if it's neat or it's cool, or if it's you know, a new technology, but it's something that doesn't become just a part of your day. I mean, like phones, if you remember, the phone wasn't, you know, the first thing you looked at when you woke up in the morning. But now, I mean, I know a lot of people. I mean, I'll be honest. The phone is the first thing I look at in the morning when I get up to see if
Yep.
emails, if there's any alerts. So I mean, I can see RPM getting that critical mass once we start getting sensors, once we start getting better telemetry data from them, where it can just be everybody. I mean, I think
Well, here,
if you
we also got. I want to dive in a little bit more. So go ahead and finish your thought here. Then I want to know about your best speaker that you saw.
yeah, and I apologize. These are all very passionate topics. So I mean, yeah, as soon as we can get to a point where you can have a device where it can do get the data and not interrupt your day-to-day lifestyle,
Yep.
that's when we're going to hit critical mass on that.
Yep. So who's you? I completely agree with you. And best speaker that you saw there.
So I mean, I'm going to be biased, but I had a very regimented day, so I pretty much had meetings throughout there. So I mean, I really enjoyed our CEO's talk that she had with the CMIO and
Yep.
Chief Medical Officer of Unified Healthcare. It was just really about empowering
Dr. Aaron
patients.
Sudbury from Unified. He was awesome. Yeah, Monica did a phenomenal job, and Dr. Sudbury did as well. Great, that was a great talk on patient engagement. Yep.
Yeah, and patient empowerment.
Yep.
Making sure that the outcomes are only going to be as good as you put effort into it. So by empowering the patient and making them a contributor to their care, you're going to have better outcomes. And I think that was kind of really what they were honing in on was we need to make sure that the patient can get access to these type of things and communicate. So I mean, like I said, biased opinion, but I really enjoyed the engagement there, and I really enjoyed the conversation. And I think it was very educational to see and hear from somebody at what I think they have 2,700 physicians. I mean, that's a real recipe for success right there when you could have talk about something like that scale.
Yeah, no, and I completely agree. They did a phenomenal job. Mine was John Mackey, the CEO of Whole Foods, because it kind of hit me personally. He spoke about the need for diet and our environment, really, on how we've got to begin to tackle. And basically, and when I say environment, I mean lifestyle. Like really, diet and lifestyle is how we're going to really bend our personal health curve. We've got it. If we don't address those things, there's no drug we can take. There's no magic pill. There's just there's no sudden decrease of anything that we're going to do, barring a significant miracle. If we're not controlling our lifestyle and our diet, and that's really what he hit home about. So I was very impressed with his talk, and I would recommend anybody that has a chance to review what John Mackey spoke about during HIMSS. It's pretty cool. It's pretty succinct, it's right to the point. But we all got to take more personal accountability for our healthcare, and we can't pass the buck. We can't blame anybody else. It's really us. At least as a really strong starting point. A lot of other factors that we can jump onto too there, but it's a starting point. And then I'm gonna ask you your coolest meeting. I'll give you a moment to think about that. But mine was with Howard Bird is an industry friend of mine. We've served numerous boards together. HIMSS board's one of them. He's an attorney in the industry, but he always does an annual dinner, and I'm fortunate enough to he invites me every year. And it's just I always meet new entrepreneurs, innovators, investors. And just really cool people in the industry. And it's always just a great mixed bag of individuals, which is always fun to meet. So that was my coolest meeting that I had, and I'll talk about some other ones in my future shows. But and also the EHR Association did a press conference, and I had not been with them since I rolled off the board, and 8 years ago or 6 years ago or so. So it was awesome to be in the same room with the EHR Association. Love them dearly. So what was your coolest meeting? I got about 45 seconds. Love to know what your coolest meeting was.
So I can't talk too much about the details, but we have announced about the partnership that Cure for You has with my long-term friends at AT&T and Samsung.
Yep.
So we had a very interesting meeting where we were talking about kind of really building on that partnership. And what I just love is for an organization, of Cure for You size, to be able to be sitting down with the Chief Medical Officer, Han Pak from Samsung, and the Global Head of Healthcare, Joe Dragas from AT&T. And, we had a number of other people in that meeting, and we're talking about, expanding the partnership and some of the really cool technologies that hopefully we can bring to market and get some press release on there. But just for me, that's that's really just goes to show you how important, organizations, the with 100 or less employees are to these mega corporations, in order to make them, because we're extenders of them. We can make them more agile. We can provide stuff that they necessarily can't do, or maybe they're not interested in doing. And that was just an amazing meeting to hear, like, these people that can have the budgets to really change things come to us and say, hey, we want to do something really cool together.
Right. Yeah, no, I got to tell you, I spent a lot of time with the AT&T group as well, mainly because of you and what you brought into that relationship. So thank you for that. But they are awesome. Love them. They've done some great work with us, and I'll certainly look forward to seeing what continues to grow there. But that's all the time that we have. So Bradley, is always my friend. I appreciate you jumping on air with me really quickly. Give me some of your quick insights. And I know you're probably going to do a few more shows across the industry. So enjoy those as well, my friend.
Yes, definitely. Thank you. Thank you so much for having me. And, thanks for shining the light on a lot of these things. Because, I think a lot of people will, they go to HIMSS and then they leave, and then it's till next year. And, let's keep this conversation. We need to keep these dialogues going, because what you're bringing up is some great poignant topics that we really need to keep discussing in the industry, because that's how we're going to get better.
You got it. So thank you, Bradley. And thank you to all of you for joining us today. Truly appreciate you taking the time out of your busy schedules to join the show. Track, if you want to listen to us weekly, you can hear us actually weekdays, 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag #ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all my shows are posted on Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. Also, you can check us on the new content we post at justinbarnes.com. Thanks, everyone. Stay safe.